cardiovascular disease, or CVD. That includes heart disease, not only heart disease, but disease of blood vessels, including strokes, peripheral vascular disease. It also includes things like high blood pressure and other things. You know, we talk a lot about, we'll talk about heart disease as well as strokes, and those are the two main things that really take a major impact on our society. If you look at all types of cardiovascular disease, if you look at the, I don't know, you may not be able to see this very well. On the right side, the big pie is coronary heart disease. That's clearly the most common. Half patients who have that. And that's due to narrowing of blockages and arteries going to the heart. And then you also have strokes, which makes up about 16% of all patients with that, and that's pretty common. And then you have other things, including heart failure, blood pressure, and other arterial diseases. So I deal with all of this gambit. Clearly, most of what I do is with the heart, but I do deal with the other medical problems, other cardiovascular disease. Look at heart disease in America. I mean, it clearly is a big, big problem, both in men and women. And a little oversight for first. If you look back at 2009, last time I had data, over 750,000 people in America die every year of cardiovascular disease. And you know, it works out about 1 out of every 3 deaths in America. And if you think about it, 1 out of every 40 seconds someone dies of cardiovascular disease, a heart disease or stroke. And it's the leading cause of death in both men and women. And half of the deaths are due to women. In fact, maybe even a little more than half the deaths. We'll look at that a little bit later. This is pretty small, I can't quite see this, but looking just at coronary heart disease, about 500,000 people a year die of coronary heart disease, like heart attacks and things. And that of heart attacks, about 750,000 people in America have their first heart attack, and about 500,000 have a subsequent or second or third heart attack. If you look at just the cost of what it costs, it's not just the physical cost, but the financial cost, it is a huge problem in our societies. Over $300 billion a year we spend treating cardiovascular disease. This is a map. It's a little bit busy, but just to quickly show you, the darker the red, the more deaths from cardiovascular disease and heart disease specifically. If you look at Texas, especially East Texas, it's particularly bad. So if you look at the southeast part of the country is particularly bad, but unfortunately East Texas, you kind of get lumped in with that southeast part of the country. And why is that the case? Well, it's probably due to a combination of things. Diet, smoking, risk factors, but also access to medical care. A lot of these areas, they have rural health care, that people may not either have access to health care or may not avail themselves of the things. Or they might not be as well informed. And that's part of my job, is to get out to communities and inform people what they can do to impact this. Looking at the deaths from, this specifically deaths from cardiovascular disease, if you look at the far left there is 1900. If you look at the number of deaths per thousands of people, or thousands of deaths per people, it was relatively uncommon to die of heart disease back in 1900. But there was a progressive rise in the first 60 years of the last century of cardiovascular deaths, and that's primarily due to lifestyle. We became more affluent, more obese, more sedentary. Smoking became much more prevalent. And it wasn't until the mid to late 60s and 70s that we really started making an impact. We finally started, we started making an impact. You can see where it starts to go down and levels off and goes down, and that's where we started making an impact with respect to risk factor identification, treatment. We started doing heart casts back in the 60s. We started doing bypass surgery. In the 70s, we started doing angioplasties. In the 90s, we started putting heart stents in. So we made slow, steady progress. Also, our medication has been much better with respect to controlling things like blood pressure, diabetes, especially cholesterol. And screening has been much better. And we'll talk a little bit about that. And I was very happy. I just redid this slide because I just got the most recent data. And there's actually been a continued decline over the last few years. But we still have a long ways to go before we reach the level back when we were there 120 years ago. So this is a similar slide looking specifically just at heart disease. It basically takes the same thing. The other one was cardiovascular disease, which included strokes. If you look at cardiovascular mortality over time, once again, this is over time. Look back 1980s, not quite far as back, but 1980s to 2004. You can see the red is in men and the white bars are women. And as time's gone on, we've done a pretty good job of treating men's heart disease, but not as good with women. They still, in fact, women make up well more than half the deaths. So it's something that we need to work on. Once again, it's probably due to women not being as aware, access to medical care, being a little bit ignored for a while. Look at the types of heart disease. Now we have cardiovascular disease, and this is just the types of heart disease. We deal with the coronary artery disease. That's narrowing blocked arteries, most common type. But we also deal, and I'm not going to talk too much about it, but there are other problems, including electrical problems, there are problems with heart rhythms, there's problems with the pump. Some people just have weak heart muscles. The arteries are fine, electricity is fine, you just have weak heart muscle and cause congestive heart failure, things like that. And finally, you can have just problems with the valves of the heart. They don't open or close properly. We deal with all these, and there's overlap. A lot of people have more than one of these. Looking at heart disease specifically in women, once again, heart disease is the #1 killer of women, period. Cardiovascular disease affects about 1 out of every 10 women in the middle-age years, and it becomes much more common, we'll see in a second, as you get older. 41% of all female deaths are caused by cardiovascular disease, and in fact, heart disease killed more women than men since 1984. So, we're doing a good job with men and an okay job with women. We do better. Looking at types of disease, cardiovascular disease compared to other types of death in women, because we're all concerned. Every woman's concerned about breast cancer, things like that. You should be. But if you look at comparisons, look at all the cardiovascular disease on the left end, it's clearly the most common cause. Look at just coronary heart disease, that's the second bar, still very high. Cancer, it's only about half as many women die of cancer, and then the stroke and other things. So it's the major thing we need to make impact. This is a similar slide looking at, if you look like, for instance, breast cancer on the right, and then you look at coronary heart disease and stroke, those are both cardiovascular disease, are much higher than breast cancer. This basically shows similar things that, and basically in Hispanic or Latino women, because I give a lot of talks to, we really need to make an impact in Hispanic women and black women, because they are, not only are they probably undertreated, but they have extra risk factors that Caucasian women don't have. They have more diabetes, high blood pressure, and it's a very, very great problem with them. Now, here's some quick statistics about heart disease in women. And this is actually talking about strokes as well. 1 in 2 women will die of heart disease or stroke, while only 1 in 27 will die of breast cancer. And that's probably due to the fact that we've made major impacts with breast cancer. I mean, it's great that we haven't quite done as good a job with heart disease. Heart disease causes twice as many deaths as cancer, and only 8% of women even believe that heart disease is a major problem, or that it's the #1 cause of death. This is a very similar slide looking at deaths in both men and women. If you look there, and if you actually look at the first column, that's cardiovascular disease, you can see that over 400,000 women a year die of cardiovascular disease, with less than that in men. And then other causes, including things like cancer, diabetes, and such. Well, let's get on to what can you do? Now that you know that it's a big problem, what can we identify? What are some of the causes and things? Very quickly, looking at risk factors for heart disease, and this also are risk factors for cardiovascular disease in general. Sedentary lifestyle, 1/3 of people in America. And this is probably something that we haven't done a very good, we haven't impacted. I looked at the data from 10 years ago, and the number's about the same. We really haven't improved that. Maybe it's a little worse. And it actually is, without any risk factors, just being sedentary is an independent risk factor for these type of diseases. Obesity is on the rise in America. Once again, about 1/3 of Americans. High blood pressure, we're doing a little bit better job. That's the numbers coming down, but it's still 1/3 of people in America are affected by high blood pressure. Smoking. Once again, we are making slow, steady impacts in the number of people that smoke, but it's still far too high, and in this part of the country, you're higher than the rest of the nation. High cholesterol. We're doing a pretty good job of both identifying and treating that. We've come out with some very good drugs. We have a lot of screening programs, but it's still something that, it's one of those silent killers. We don't feel our cholesterol being high, just like diabetes. Still, diabetes is a big problem. That goes hand in hand with things like diet and obesity and such. And about 8% of Americans are diabetic, but unfortunately, there's about another 3.5% that are undiagnosed. They have diabetes, they're undiagnosed. And then here's the big problem. 38% of people have what's called prediabetes. You might just have a little high blood sugar, you're not on treatment for it, but that is a risk factor for having disease as well, even if you're not on treatment, even if you haven't been labeled as being a diabetic. Family history, we can't change the family we were born into, but it is important that you be aware of that and be extra vigilant in treating those risk factors and taking care of yourself. Looking at just young women specifically, and I give a lot of talks to young women too, there's some specific problems. One thing is physical activity. You look at and I'll have another slide, that women quickly become less active. With the little kids, they're about just as active, playing around the playground and stuff. Once girls become in high school, and certainly once they get in college, become far less active than men. That becomes a problem. And same thing with obesity. It's become a connected problem. And then 80% of smokers start before they're 18. A lot of young teenage women, despite the risk, despite what we know, continue to start smoking. This is looking at rates of obesity, and I believe this is in all comers. Let me just see. Yeah, this is in adults, 20 and over. And if you look at the far left corner is back in the 1960s, early 60s. The far right column in each one of these, men being on the left side, women on the right side, is most recently the last few years. And you notice there's a steady increase in the rates of obesity, which has been a problem. And even since I started giving this talk a few years ago, there's been a continued rise in that. And that leads to other risk factors as well. And if you notice, women are higher than men in the rates of obesity. This is the same thing. This is looking just specifically at adolescents, which is really where the problem occurred. And once again, it continues to rise, primarily due to both diet as well as inactivity, the rise of video games and things like that, and kids aren't just getting out as much. This is looking at obesity trends over years, 1990s, the far left, should be 98 and 2006, the maps. And as you go from white to blue to dark red, the prevalence of obesity goes up. And if you notice down in Texas, we're among the bad states down here. We not only have had a rise, but we're also among the highest rate of obesity. This is looking at physical activity, which is, once again, an independent risk factor for the development of cardiovascular disease. And this is looking at kids in grades 9 through 12, and men and women, of how many people actually met the recommended activity. And boys, or young men, do a better job. About 60% of them are active enough, whereas only about half of that, 30 to 40% of girls, young women, are active enough. So that's a big issue, skinny women. And just as a complete aside, it's not really cardiovascular disease, but the number one determinant of whether a woman has like a hip fracture or other sort of osteoporosis when they get older, thin bones, is how active they were when they were teenagers in young college. So the best thing you can do for if you have young children, grandchildren are young, make them be active when they're young, because that's when you put down your bone and stuff to prevent the hip fracture. So that's important. It doesn't do with the heart, but it's a major thing. This is looking at body weight and weight gain, and then the risk of developing disease later. So if you have people that from when they're 18, and then you find out how much weight they gain after they're 18, and then their risk for heart disease. If they gain 10 to 20 kilograms on the left, their risk of developing heart disease is about 2.6 times the average. And if they gain 20 kilograms or more, their risk goes up to 7.5 times as much. So that's a problem. This is looking just at body mass index. This is kind of a measure of obesity. And clearly the risk, once again, the risk goes up the heavier you are. So suffice it to say, and clearly it goes down if you go the other way. So that's always good. Smoking, number one reversible risk factor for cardiovascular disease. Something that you can't change your family, but you can certainly go completely without cigarettes, and that's important. If you look at the people who never smoked, if you put their risk at 1, people who smoke a little bit still have a 3 times as much risk, and if you smoke more than 15 cigarettes per day, it's 5.5 times the risk of developing cardiovascular disease. Looking at we talked about young women, middle-aged women. Well, you have some particularly significant risk factors. In fact, that postmenopausal women have a much higher incidence of cardiovascular disease, especially if that comes early. So that's something to be aware of. And then, as women get older, their risk of have cardiovascular disease not only becomes similar to a man, but actually gets greater. We'll see that in a second. Lifetime risk for developing high blood pressure for women over 55, 90%. 90% of all women get over 55 will probably get high blood pressure. So if you didn't have it before that, continue to monitor that. And then, once again, women tend to have a little higher cholesterol as they get older. We talked about the blood pressure being a problem. Tend to have, often have silent heart attack, just hardening of the arteries that puts you at risk for things like strokes and stuff. And then the average age for a woman to have her first heart attack is 70, which is it's later than a man. Most men, their first heart attack will come in their 50s, 60s, so it's something to be aware of. This is once again looking at the prevalence of cardiovascular disease with age. 20 to 39 on the left side and over 80 on the right. And as you can see, women are a little bit less than men, that they're being the white column there, at younger age, before 60, but by the time they reach 60, they become equal and actually surpass men in their risk for developing heart disease. This shows a very similar thing, but with respect to heart attacks per se. And as women get older, they're the white column, their risk starts to really escalate with their number of heart attacks they have, where men kind of peak in their 40, 60 years old, and then actually start to level off as they get older. Diabetes. This is a big thing. I talk a lot about diabetes because it's the number one medical cause for cardiovascular disease. And unfortunately, if you look at this pie chart here, the upper right pie, 26%, are the number of people who have diabetes that are treated and controlled. I mean, 3/4 of people either aren't controlled or they don't know they have it. If you look down there, 40% of people are treated. They know they have it. They're on medicine, but they're not controlled. And then if you look at the other corner there, 1/4 of people are not treated. They're not even diagnosed, and they have it. So it's a big thing that we not only need to diagnose it, but we need to treat it. And that's why I recommend you see your primary care doctor, get screened for it, and get treated. This is the risk of development of coronary artery disease, and as you go on and have diabetes, the longer years you have it, the worse, especially if it's untreated. If you look at diabetic versus non-diabetic women specifically, that as time goes on, your mortality escalates. So it's something to get identified and treated. Symptoms of heart disease. We'll talk about general symptoms and talk about women. These are the general symptoms of heart disease. Chest pain, the classic, pressure tightness. Though I have to say that a lot of people don't say pain. They can get a lot of atypical symptoms. Arm pain, neck pain, jaw pain, trouble breathing, just decreased exercise tolerance. Some people say, they come to me and say, doctor, I used to be able to walk a couple miles, now I can't walk to the mailbox. Sweating, nausea, palpitations, all can be signs of heart disease. We need to know that women are more difficult to diagnose. They tend to have more what we call atypical symptoms. They're not typical symptoms. And that as the disease becomes more advanced in women, they often have a poorer outcome. So it's something that we need to keep an eye on. Women need to be aware of this. Once we talked about not having classic symptoms. And then about 95% of women often have some warning signs, but they ignore it. They thought they were indigestion or night sweats or something else. So it's just important to be aware of that. So talking about women's symptoms, they did a survey, looked at women's heart disease, and some just have unusual fatigue, sleep disturbances, indigestion can sometimes be that, unusual anxiety, shortness of breath, weakness, fatigue, cold sweats, dizziness, all things that often happen in women that are a little less common in men. Talking about not heart disease now, strokes, it's important the warning signs, and these are things to be aware of because this month we not only look at heart disease, especially the American Heart Association does a lot with strokes. Things would be sudden weakness, numbness of your face, body, confusion, trouble seeing, all things that may or may not be due to stroke or a stroke warning sign. These happen. Certainly let your doctors know. If it happens and suddenly, sometimes the best place is to go to the emergency room. There are things we can do now to treat strokes, like we can heart attacks immediately, but you got to get to us very quickly. All the hospitals around here are very aware of that. They're set up to treat those things, so be aware of that. This is the prevalence of stroke. This is kind of like heart disease. Once again, you see women and men, as they get older, you almost see this this acceleration, and by the time a woman's over 80, it's about 14% of the women have or had a stroke by that time. Now, you might say, well, here, women, why do they have problems and stuff? They looked at a study of women in getting heart disease treatment and cardiovascular treatment and prevention, and they looked, and women tend to have less cholesterol screenings than men, less lipid-lowering therapy, less treatment for high cholesterol, less use of various medications that we often use to treat heart disease when we get in the hospital. That's partly our fault. That's just the doctor's not doing as good a job. Often fewer referrals to cardiac rehab, and they do well in rehab, but we often don't do as well. And then if we look at defibrillator implants, little devices they put in there to study, and they tend to get less of those, even though they have appropriate reasons to have them. Prognosis. So once a woman gets heart disease, how do they do compared to men? Not as well. In fact, they have about a 2 times greater mortality rate, meaning they die more after a heart attack. I mean, a man and a woman, same age, they both have heart attacks. Women tend to do worse. They tend to also have higher rates of disability, depression, things like that. And they also tend to be back in the hospital more for various problems. So once again, we talked, just to reiterate some of these, heart attacks is twice as deadly in women, so you're twice as likely to die if you have a heart attack. 38% of women will die within 1 year after a heart attack versus only 25% of men. More likely to die of a stroke, and then particularly African American women are 60% more likely to die of cardiovascular disease than white women. If you look at death during hospitalization, so if somebody gets admitted with a heart problem, what is the risk of dying? And the upper graph there is actually women, the lower one. So women tend to do worse. That means they're more likely to die during the hospitalization when they have a heart attack. Now, a lot of bad news. What's the good news? There's things we can do about it. Living a healthy lifestyle. First and foremost, diet. Diets, it's not just losing weight, but it's balancing the things. Eat more fruits, vegetables, a little less fat, a little less calories. Exercise regularly. When I say exercise regularly, I don't necessarily mean you have to go join a gym. It's just a matter of exercising more than you do. Taking the stairs when rather than the elevator. Parking a little bit farther away. When you go to Walmart or the department store, walk around a few times. Things like that can help. Clearly don't smoke. We talked about that. And try to limit your alcohol use. None of us do a very good job of this, of managing our risk factors. I have to admit, getting on the side, last month I actually sat in on were you guys here at Dr. Cavalier's talk on things like that? I have to admit I was the one person in the room that hadn't had a pap smear in my life. So even I don't follow all the doctor's recommendations. I hope that some of you take this to heart. It's just not, once again, it's not about being more, you don't have to be fanatic, but just be a little bit healthier will make a major impact. Prevent or treat your medical conditions. This is things you can do with your doctor. Get your blood pressure checked. Get screened for these risk factors, diabetes. Take your medicine. Talk to your doctors. If you don't tolerate your medicine, don't just stop it. Talk to them. They can change and move it around. I'm going to go over this very quickly. Well, I often get asked about hormone replacement therapy. It's kind of a double-edged sword, and you've probably seen it come and go. Currently, it is not recommended that women take hormone replacement to prevent cardiovascular disease, certainly heart disease. It's probably somewhat neutral when it comes to heart disease. It actually increases the risk of strokes. It does decrease the chance of hip fractures and colorectal cancers. So it's a balance. The current recommendations are, if you really need it, talk to your doctors. Some women certainly do need it. But we don't recommend it as a routine for that. And this, I'm going to quickly go through these because if you have questions later. We talked about coronary artery disease. This is a quickly diagram. If you look on the right side, it shows blocked arteries. You probably see pictures and stuff. And this is what it causes. And in the heart, that narrowing, that plaque buildup can cause a heart attack. And this is once again showing on the left side is a slide I took of a patient who unfortunately died of it, but shows a big blood clot as well as a ruptured plaque in the artery. There's things we can do. Myself as a cardiologist, we can go in there and open these things up. We've been able to do angioplasty with little balloons, and now we can put what's called
stents in there, little devices that kind of hold open the arteries.
Yeah.
And we made major progress in doing that. And that kind of shows the little stent on the balloon on the left side, and on the right side shows it's kind of propping it open. This is just a big enlargement of a stent. This isn't projecting very well, but this is a patient I actually had, came in with an acute heart attack and had a blocked artery, and then we put a stent in over here and kind of opened up the artery. So there was basically no artery there, we opened it up. And these are things we can do, but patients need to get to us and get to us fast, so they need to be aware of that. And then we still do good old-fashioned bypass surgery where we if patients aren't candidates for the balloons or stents, where we can basically build detours around the blockages. This kind of shows that if you have a blocked artery up here, that the surgeon comes in and basically builds this little detour around the blockage. And then, of course, you are all here because you're concerned not only about yourself, but about your community and things you can do in your community to help out. First and foremost, learn CPR. That's very important. Communities where they have a high rate of people knowing CPR have a much better survival rate if you should drop dead on the street. So learn that for yourself, your loved ones and stuff. Encourage friends and family to lead healthy lifestyles. And if someone's trying to quit smoking, be aware of that, realize they're going to be a little grumpy, but encourage them to do that. Automatic external defibrillators, or AEDs. You probably heard about it. You've probably seen them. You see them in airports and other places. These are really life-saving. They're pretty cheap these days. I would encourage you to, if you know of places that don't have them, if your church, your community centers don't have them, to get them installed because they do save lives. Basically, they're little devices that you put on the things on the chest if somebody should have a sudden heart attack where they pass out. It can identify the abnormal heart rhythms and get them out of it. I had a case where there was a 17-year-old young man, high school student, playing football at a community I used to work in, and he dropped dead on the football field right there on the 35-yard line. And the high school, our high school, did not have one of these defibrillators. Their high school, thank goodness, they actually brought one, and the trainers had it at the sidelines. They brought it out, put it on this young man, shocked him, and saved his life, and he's now doing fine. Now, as an implantable, we now have a permanent one inside of his chest. He just had unlucky abnormal heart rhythm that he would have died from. So it's something to be aware of. Support your local emergency medical services. These people that you see driving around, ambulances, paramedics, be very, very supportive, because these are the people that are my eyes and ears, and they do the initial assessment and treatment and get them to me so I can do things like open up that artery and such, or get them to do other things. So, you thank them. Most of them make barely minimum wage. They do it for the love of it, and so go to their, fundraiser events, and if you ever see them, certainly thank them. Other things you can do, support the American Heart Association. I'm a big fan of the American Heart Association, and you guys can get little pins like this from them. But they have a wonderful website that you can all go on, and you can do a little self-assessment. It's free. You can do that and kind of see your risk factors. They also have resources both in the local community and other places to help you out. And they also do major research for us. So I would encourage you to support them. The Red Cross also is a great supporter of that. They often sponsor a lot of the CPR courses and other things and such. So that's pretty much it.